We are right at the point where we start to see more visits to the ER and hospital for respiratory viruses, and certain groups of people are at extremely high risk of having either worse outcomes or unfortunately even losing their lives because of these viruses. We see upwards of 1,500 to 2,000 deaths every winter, unfortunately, from flu, and even more from COVID.
Hi, everyone. Thank you so much for joining our Respiratory Viruses and Media Roundtable. Today, we are joined by Acting Commissioner Dr. Michelle Morse and Dr. Tristan McPherson. He is the Acting Medical Director of the Division of Disease Control. I will hand it off to Dr. Morse to give some opening remarks.
Great. Thank you, Chantal. And thank you also, Dr. McPherson, for being with me. Thank you all for making the time for this. As you can imagine, it is more important than ever that New Yorkers know that I, as the city's doctor, am focused on making sure that access to vaccines as we head into respiratory viral season remains completely as easy and as few barriers as possible. It's particularly important at this time, I think, for us to be saying that and for engaging and to be engaging with you all, because there has been confusing messaging from a lot of different directions. And what is important to know is, of course, that I want every New Yorker to be as safe and healthy as possible this winter and this respiratory viral season. Again, the best way to do that is by getting the updated flu and COVID-19 vaccines, and then if folks are eligible, the RSV vaccine as well. We are right at the point where we start to see more visits to the ER and hospital for respiratory viruses, and certain groups of people are at extremely high risk of having either worse outcomes or unfortunately even losing their lives because of these viruses. We see upwards of 1,500 to 2,000 deaths every winter, unfortunately, from flu, and even more from COVID. So it's really important, again, that New Yorkers know these viruses are not to be played with at all. They're quite serious, and the best part, again, is that with updated vaccines, you can protect yourself, your family, and your whole community. So with that said, I'll just say really briefly, for the flu vaccine, our recommendation is that everyone 6 months and older get the flu vaccine. But again, acknowledge that there are certain groups that have a higher risk of having really bad outcomes, like being hospitalized or being in the emergency room or worse. So those people who are at higher risk are people who are 50 years and older, kids who are under 5 years, and then people with underlying conditions and people who are pregnant. So again, flu vaccine is updated every year based on the flu virus that we think is going to be circulating the most. So that's, again, another reason why great if you got it last year, but you got to get it again this year to be the most protected and safe as you can possibly be. Second, COVID vaccine guidance. Again, there is no new data that raises any concerns about the safety of the COVID-19 vaccine. So I just want to make that very, very clear. We recommend the updated COVID-19 vaccine for anyone who's 6 months and older. And again, everyone will benefit, everyone 6 months and older will benefit, but the groups that will benefit even more and will have lower risk of really bad outcomes, scary and concerning outcomes, are people who are over 65, babies who are 6 to 23 months old, people who have underlying chronic conditions, and people who are pregnant. So again, really, really important to get the updated COVID-19 vaccine. The RSV vaccine is for people who are 75 and older, and then for people age 50 to 74 who have some chronic conditions, and then also for pregnant people. And then if someone has a baby, a newborn, and the mom was not able to get the RSV vaccine during pregnancy, then their newborn should get the RSV antibody treatment. So there are several different options for RSV. The final thing I'll say is that we are very, very in tune with the fact that not everyone may have health insurance. and that it may be difficult for some folks to get access to these vaccines. The state and the city have worked together to make the vaccine as low barrier as possible and available for anyone who wants them. The place where you can find out if there's a place near you, either no cost, whether you have insurance or not, is our New York City Health Map. And if you go to that New York City Health Map, and I think we can send that link perhaps in follow-up or put it in the chat, all you got to do is click on the link to the map. You can put your address in and you can see what the sites are that are around you. You can search by vaccine type. You can search by neighborhood. You can search by insurance type. You can search by not having any insurance. And you can also call 311 as well to get this information. So we want to make sure, again, that the vaccine is as accessible as possible. And again, my goal as the city's doctor is to make sure that New Yorkers are safe and healthy this winter. So get your updated vaccines. I'll pass it back to you, Chantal, for any questions.
Thank you so much, Dr. Morse. Now we will open it up for any questions that folks may have. You can type it into the QA box or raise your hand and I will unmute you. I think to kick us off, Dr. Morse and Dr. McPherson, which months are considered flu season?
I'll pass that one to you, Dr. McPherson, if you don't mind.
Of course. Flu season can be a little bit different every year, but normally we consider that kind of from the late fall into the early spring. So that's why we're always trying to help ensure that people know about getting vaccines so that they can be well protected as those months start.
Thank you so much. And another question here, can either shot make you sick? Folks have heard that either getting the flu shot or the COVID shot, they get sick right after with either virus. Is that possible?
I'm happy to answer that question. So these vaccines are not really made from a live virus, and so you can't get flu or COVID from these vaccines. Sometimes, just like with any medication, you can have a mild side effect, and so you can definitely take medication to help with those symptoms. But for the most part, any of those side effects, people recover well, and they're well protected from those infections, which is really important.
Thank you. And another one coming in, how do respiratory viruses spread?
So that is also a great question. So respiratory viruses generally spread just from person to person, and that's usually from coughing or sneezing, anything that might create kind of droplets from the mouth or the nose. Sometimes those viruses can also spread from hand contact. We all touch our faces, wipe our nose, cough into our hands at different points, sometimes without realizing it. So that's why it's really important to wash your hands during what we would consider this respiratory viral season, because just as you might try to cover your cough, you just want to make sure that your hands are also clean because that can also help prevent the spread.
Thank you for sharing that. And then what are other ways that folks can kind of help reduce the spread, like during the holiday season, in addition to getting the vaccine?
Yeah, I think that's really important to think about how we can pitch in to try to keep everybody healthy. So if you're not feeling well, the best thing you can do is to stay home and to stay away from other people, especially people who might have other illnesses that could make them sick as well. Like I said, washing your hands is really important because that can also help prevent the spread of infections. And then also, using masks when you have a cough, when you have a runny nose, and any other symptoms like that can actually also really help. So those are kind of a few different ways that you can kind of help protect your family and those that you're close to.
And we've got a question in the chat, and then Max, I'll kick it off to you. Question in the chat, what advice would you give to someone who's having flu symptoms? Under what circumstances should they see a doctor?
Yeah, that is a really great question. If your symptoms are mild and you maybe have just a cough or a mild fever, usually it's okay to stay home and just take some other medications, keep yourself well hydrated to make sure you're safe. But some concerning things, if you were having trouble breathing or if that fever wasn't going away, that's definitely a moment that I would consider seeing a healthcare provider. One other thing I think that's really important for this is, infections like the flu and COVID, there are medications that can actually help get you better faster. And so that's another reason that you might want to see a doctor. And then finally, if you have some underlying medical conditions, especially something like a chronic lung disease or potentially have a history of smoking, you really might want to consider seeing a doctor earlier just because those infections might get worse really quickly. And we just want to make sure that you have somebody taking a look at your medical history and giving you the medications you need.
Okay, Max, you can go off mute now and ask your question.
Hi, thank you guys for doing this. I just have a question. Can anyone talk about the importance of the COVID vaccine? It's 5 years removed from the height of the pandemic, but obviously you guys are still talking about it.
Dr. Morse, you want to take that one first?
Sure, I can kick it off. Well, first and foremost, yes, I think number one, we're thankful that we're no longer in the emergency phase of the COVID pandemic. Unfortunately, thousands and thousands of New Yorkers lost their lives during that time period. It was very difficult, as you know. I think the good news is that the vaccine clearly prevents the bad complications from COVID. And we are still seeing quite a bit of COVID circulating. In fact, we had a little wave this summer, and just about every winter at this point, we have a pretty significant increase in COVID cases. So even though we're out of the emergency phase, COVID is definitely still circulating, still making people sick, unfortunately. And our goal is to both reduce the chances of getting really sick, like having to go to the emergency room or be hospitalized or even die from COVID. And our other goal, of course, is also to decrease the chances of long COVID. And some of you may be familiar with, some of the symptoms that come along with long COVID. They're really not fun. The vaccine, the updated vaccine, significantly decreases the chances of all of those things. And so even though we're not in the emergency phase, there is a lot of protection offered by the COVID vaccines, even in this phase of COVID circulating. And, I think even more importantly than that honestly, we have great safety data about the COVID vaccines because billions of people around the world have received the vaccine. And it is very, very clear that it is a very, very safe vaccine as well. So there's almost no downside to getting it.
Anything to add, Dr. McPherson?
I mean, I think the only thing I'll add is, I recommend getting that to the patients that I see when I'm in the hospital. I also, take it myself and recommend it for my family too. So I really do just want to emphasize the safety of the vaccine and just preventing kind of those really bad outcomes that we just don't want anyone to experience.
Thank you. Another question in the chat. Can you briefly talk about the long COVID symptoms?
I'm happy to take the first shot at that, and Dr. Morse, feel free to add additional things. We're still learning about long COVID. There are a lot of symptoms that I think people have reported that have been associated with long COVID. And I think some of the biggest ones are kind of really extended periods of fatigue that can last, for months. We think about some of the other underlying things with COVID, like having kind of brain fog or kind of mental slowing, really not being able to focus as much as they once were, but also kind of a predisposition or an increased chance of just having other chronic lung issues associated with long COVID. So there really are a lot of things that can happen with it. We're still working to understand a lot of those things. But what we've seen is that vaccines prevent almost all of those symptoms from happening and really decrease your risk. So I think that's the point that we really want to hit home with everyone, is that getting a vaccine can really help decrease that chance of happening. So.
Thank you. We've got one more question. Will there be any cooperation with the Department of Education in order to help students get COVID vaccines?
I can start, and then Dr. McPherson, please feel free to add. We do work really closely with our colleagues at the Department of Education or New York City Public Schools. We send messages out through the kids to the parents about respiratory viral season, and our school health nurses also, of course, help with some of that education. Although the COVID vaccine is not required, it is, again, certainly encouraged. And particularly, as I mentioned earlier, for kids under 5, as well as for babies 6 months to 23 months, there's really significant benefit for these vaccines, although all kids would benefit. So we do some of that work, but Dr. McPherson, please feel free to add.
Yeah, I mean, I think we continue to support the idea that these vaccines are safe and effective for kids, even if they don't have underlying health conditions. So we are really thoughtful about our work with the Department of Education, and we also have a Bureau of School Health that works really, really closely with them as well. So they're really supportive of vaccine and always happy to answer questions about it, especially as kids are in school and may have thoughts about it. So yeah, thank you.
I see some folks are typing at the same time. While we wait for those, okay. Have you noticed any areas of the city where flu and COVID hit the population the hardest?
Yes, I'll take again the first shot at this, and Dr. Morse can definitely add more. I think one of the things that we at the health department are really focused on are really the structural and systemic inequities in our city and across the country, honestly. And that really focuses on structural racism. We know that influenza and COVID do hit communities of color much harder than in other places. And that's because our systems and structures are not set up to support those communities in the way that they should be. We do a lot of work really to overcome that and try to increase resources in those areas because we know how important that is. But I think it is important to name that up front. And every year as we plan around this, so much of our focus on time is on structural racism and how that can be addressed for COVID and flu, but specifically on prevention.
Dr. Morse, you want to talk a little bit more about our new data portal? I'm putting the link in the chat.
Absolutely, yeah. This data portal is going to allow you to look at the 3 main viruses that we see during respiratory viral season, so flu, COVID-19, and RSV, and look at it by age, by borough, by race, ethnicity, and a few other kind of different characteristics. And that, I think, will allow folks to really get a pulse on what's happening in your community, in the groups that you're worried about. And it will also show you that, just as Dr. McPherson said, the patterns that we see are sometimes and often, frankly, quite unfair. Not due to any specific behaviors or failures of any particular groups, but really due to the way in which we've prioritized some people over others historically in our society, and how that leads to differences in access to healthcare, treatment, vaccination, prevention, time off from work, to be able to get vaccines, and so many other things. So all of those patterns and social forces and decisions show up in the patterns that we see in the data on this respiratory illness data page. But we encourage you all to both share it with, share it through your media outlets and news outlets, and encourage New Yorkers to really use it to protect themselves maximally, and to see where their groups and communities show up.
And this data portal will be updated every Thursday. So every Thursday, it will have the new data from the previous week, and we'll compare it to the week before that. So you can track throughout the season. One more question from Max. Who can get a COVID vaccine now? There has been some confusion due to the Trump administration's shakeups and new recommendations.
I'll start. Both New York State and New York City have worked really hard to ensure access to vaccines, given the confusion that you mentioned at the federal level. And so the recommendations that Dr. Morse mentioned earlier for people to get vaccinated, those are all available across COVID-19, across flu, and RSV. So really anybody that falls into those categories, so 6 months in age and older, should be able to get a COVID and flu vaccine here in New York City, and you can use our health map to find access there. And then the RSV vaccine is a little bit more limited just based on recommendations and who it would be helpful for. But the COVID vaccine should be available here in New York City.
Anything else to add, Dr. Morse? We can leave it for 2 more questions. Dr. McPherson, Dr. Morse, can folks get more than one vaccine at the same time during their visit?
Yes. And in fact, Dr. Morse just administered a double shot to somebody for influenza and COVID-19. And really the recommendation is that since you'll be seeing your healthcare provider or a provider that's giving you the vaccine, to go ahead and just do both. There hasn't been any decrease in their ability to protect you when given at the same time, and it's probably just more convenient for you. So we definitely support that.
And one final question, who is most at risk from complications from each respiratory virus?
I think the general sense that I would say is, if you have underlying medical conditions, and there really are a long list of those, which